Next question is, how come NYCIM, that's the New York Center for Innovative Medicine, does not do telemedicine?
Yeah, this is a big one for me because I'm not a fan of telemedicine. I know the trend is, and it's so convenient, everything. For me, it's like calling in a gym session, like medicine is hands-on a lot of times. And maybe it's because we work with chronic complex conditions. I understand if you have a little bit of something, I'll do the same with my father. I'll be like, hey, I have a little bit of a GI, and he'll even be like, well, I gotta, look at you a little bit more and assess you. I can't just say to you, but, take this and take that. And it makes it easy and people take it. And usually the body improve if it's in a state to do so. But when you have a complex chronic condition, the idea of telemedicine to help even is completely like darts in the dark. You are totally guessing about a patient. They're going to tell you something. You're going to say, well, sounds like you have this. Let's put you on this. And you could be doing that forever, especially when it's a complex disease. If you can't come in, get a proper analysis with a doctor one-on-one right there, and get treatments that may require invasiveness. Listen, we have over 100 different therapies here, and they're very complex. They're very advanced. You can't just take them home with you and do certain IVs, or can't do neural therapy, which is very, specific injections into certain points that stimulate organs. Medicine to me is still an art form. It's not something you just call in and do. I understand telemedicine's place, but like conventional medicine, I think its place is, somewhat limited. It's absolutely useful, but in limited numbers. So that's why we don't do it. We want to have you in. We want to build a relationship with you and also provide you with the hundreds of tools we have in-house that we combine for you that you just couldn't get elsewhere. You can't. And again, people like, can't I just buy all this and get a nurse to come into my place and do it? Like, that's not how you do it. You can't just mix and match everything and do it. You have to have this very, very unique and specific order to everything and priority and skill set to do it. I've had people, that have gone elsewhere and they didn't get the same skill set in the therapies, and therefore you will not get the same results. So much of that is my reason of like why I get why people, it's much easier if a doctor just sits, in his own house and answers calls and, just sends, you to full script or just sends you a prescription. But to me, that's not going to solve the 60 to 80% of the people out there with chronic conditions that are quote unquote incurable. I think, you got to be hands-on. You got to be in the gym. You got to be working with the coach face to face to win that battle and really restore your health. And that's why we don't really offer it unless you're already a patient and you may have questions. We'll jump on the phone, but not in a manner of like telemedicine, let's say.
Yeah, I think this is a question that's very understandable why it comes up, because people want this accessible in all different places. But it's also, once you really understand the how innovative medicine treats, it becomes very clear why it's not possible, for all the reasons you said, just that there are these hundreds of unique therapies and treatments and ingredients and things like that is even hard for innovative medicine to get, but they do. And, on the face of it, people might think, well, my doctor does IVs. Can't they just do this one and you do that one there? But it's kind of like if you think of, trying to put together a puzzle where the pieces of the puzzle are spread out all over the country, it's just not going to come together, at least not in the same way. Not in
the same way, right? You could try and do it, but it's just not as effective. And when it comes to disease, I think you have to be as incredibly efficient as possible. You can't be like trying to do the shortcuts here and there that may extend or may do this. Like, just get to the point. That's what we're trying to do, is get you to healthy as quickly as possible as your body, can handle.